Abdominal pain. Now, abdominal pain is a broad subject, but if someone is concerned about a specific disease such as diverticulitis, the pain usually is acute. More often than not, it is a pain centered to the lower abdomen. More commonly than not, the left side of the abdomen. We call it the left lower abdominal quadrant. That is an area where most of the diverticuli usually occur. It's an area where the bowel is somewhat narrower and a little curved. And when diverticulitis occurs, develops, that means inflammation within the diverticula, the pain will be or can be quite severe. It could also be mild. Patients may develop a change in the bowel pattern. They may become constipated. They can't eliminate the stools as well. They may feel bloated. Sometimes the pain is quite intense and the patient is doubled over. Sometimes the patient can have a fever with chills, a sign of infection. What diverticulitis really is, the definition is a perforation, that means a little hole that could be small, doesn't have to be large, in one of the diverticuli or in several diverticuli. So in the space, the area of the colon where these are located, things become narrow, swollen, we call it edema. Pus can collect, and that is called abscess, and therefore patients can be quite ill. They need to be seen promptly. Many cases of diverticulitis tend to be mild. Mild in the sense the patient can be seen by the physician as an outpatient, evaluated, diagnosis established, and be treated with antibiotics. The specific way to make the diagnosis is not only the clinical presentation, the clinical findings, is the need to do an X-ray, a CT scan with contrast of the abdomen, focusing in the area where the pain is present. Now, that doesn't mean that you cannot have diverticulitis in other segments of the colon. It could be on the right side, it could be in the mid-portion colon, transverse colon. But as I said previously, the left side of the colon, the sigmoid colon, is the predominant site where diverticulitis develops. But abdominal pain is a broad symptom. It's caused by many conditions. So it's important for the physician to know how to proceed and differentiate, what we call establish a differential diagnosis for other conditions. There could be a catastrophe or something is leaking into the abdomen. There could be another abscess. There could be a perforated appendix, and so on. So that's why prompt evaluation, the proper X-ray studies and laboratory studies as well, and then proceed with the treatment and follow-up.